Doctors of Reddit, what is your most surprising I can't believe I need to have this conversation with an adult story? Paramedic here, was driving with my partner and patient in the back. Patient was fine. Patient's skeezy boyfriend was riding in the front with me and apparently saw a golden opportunity to ask a question that had obviously been on his mind for some time. So when cats and dogs eat grass, that means they have cancer, right? Me. Number. No, it does not. Made for an awkwardly silent ride the rest of the way. Well, it looks like she is about 30 days pregnant. Congrats. How can she be pregnant? She is only around her brother. Well, actually they don't follow the same moral code as you or I. Veterinarian. My fragile sanity wishes you had started with veterinarian lol. Not a doctor, yet, but in a tech for 2 years. Mum comes in with her baby plus 2 more older kids. Complains that the baby hasn't pooped in a while and won't stop crying. As I'm settling them in with one of the nurses, the baby is bawling, like opera singer lungs bawling. Suddenly mom whips out a white plastic shopping bag and sticks an end in the kid's mouth. Says this is the only way she stops crying. Nurse and I share a look and immediately order an emergency x-ray on the kid's stomach. Turns out she had ingested a good amount of these bags and it was blocking up in her stomach. Big deal. Potentially life-threatening. When we confront the mom about her baby feeding habits, her only words of defense are, well, I checked all over the bag and I couldn't find anything that said non-edible. God hope this mother lost custody of her children. That the 30+ cups of coffee he was drinking every day could possibly be the cause of his chief complaints of anxiety and insomnia. He said he was not willing to give this up or try decaf. 30+. Man, I'm such an amateur. This will be a long story. When I was an internal medicine resident, I came across a very nice 50-year-old Dominican lady. She was well mannered, but one could tell she was not the sharpest tool in the shed. As I was prepping her chart for our first visit, I noticed that she'd been seen by every single digestive disease MD in our hospital system. Not only that, she'd had every single procedure in the book, ranging from endoscopies up both holes and culminating in an exploratory laparotomy you open up to basically look inside you when we have no clue what's going on. All of this because for years she had one single complaint. She reported severe gnawing pain in her stomach. At this point I should mention that she was Spanish speaking only. Not only that, she had a very heavy Dominican accent, and I was the first Hispanic doctor to ever see her. My first language is Spanish and even I had difficulty understanding her. So she comes in and after exchanging some first time pleasantries I politely ask her how she's doing. Sure enough, although she was smiling and said she felt well, she pointed at her belly and said it was biting again, and asked for the cream to kill it. At this point I got intrigued. Her medication list only mentioned a cream used for herpes breakthroughs. The previous fellow only mentioned in his note that in every single visit she only asked for the cream and nothing else. When I asked what she meant by the biting and what she intended to do with the cream, she very calmly tells me she intended to stick the cream up her butt in order to kill the bird living inside her. After delving more deeply into her story, it turns out she didn't have a medical condition. Ever since she was a little girl, she believed she had after eating whole quail egg. The bird had spawned inside her and gnawed away in her insides whenever she was very hungry. After a short visit to psych, she was diagnosed with a somatic type delusional disorder. No amount of medication or psychotherapy will cure her, but she was still a fully functional mother of 2 who paid her taxes and had 2 part-time jobs. I reached out to every digestive disease doctor in our hospital system once more to make sure she never receives an inappropriate invasive intervention. I've been following her now for 3 years and she's happy as one can be, considering she has a bird living inside her. While in dental school, my friend pulled out several bombed out, technical term, teeth on her adult male. After the procedure was finished and post-op instructions were given, the man asked, "So when should I expect my new teeth to grow?" and he was serious. My SO is a med student. He helped to diagnose a 40-year-old woman who finally sought out a doctor after having open, festering wounds on her entire torso for over a year. The open wounds only appeared after more than a year of painful, visible lumps on her breasts. She had never sought treatment prior to this. SO had to inform her that her entire body was riddled with cancer, that there was no treatment to help her, and that she would be dead very soon. Her sister, who was there the entire time, began loudly proclaiming what a shame it was that nothing could ever have been done, and that hopefully someday we would be able to detect cancer sooner. So, watched the doctor explain that pretty much any other woman in the country would have gotten effective treatment at the first sign of the lumps. This was during Breast Cancer Awareness Month. I saw a patient who was concerned because she was still lactating, despite the fact that she stopped breastfeeding her twins 2 years ago. She said, "Sometimes I wake up in the middle of the night and find my husband sucking on the breasts. He says he's trying to drain the milk for me." I had to explain to her that breastfeeding her husband will lead to continued lactation. As a veterinarian, I had a 10-minute conversation with an owner explaining which side was the dog's left side. Medical assistant to a cataract surgeon here. If you freaking sleep in your contact lenses long enough, they will fuse to your eyes and will need surgery to have them removed. Yes, you can go blind from this. For the love of God, don't sleep in your contact lenses. Got placed doing a rotation in the orthopedic floor of a big hospital in a rural area of Southern California. I was doing my rounds and saw a patient out of bed and walking around the floor following a knee replacement. She had a cane in her hand that she was carrying like as a soldier would carry a rifle. I asked what she was doing and what she thought the cane was for. She replied she thought the cane was for pushing people out of her way since she's now handicapped and it wasn't to help her walk on her post-op knee. This is the first response that genuinely made me laugh out loud. I can just imagine some cranky old woman swatting people out of her way. Talking to the children powers of nursing home residents about vaccines. Most will just sign the flu shot form. Some believe it will give their 90-some grandpappy autism. Pharmacist, but comment still relates. Had a lady call in complaining that their husband's Viagra wasn't working. I then went on to explain to the patient's wife that in order for the medication to work, the patient needed some sort of stimulation. The lady just screamed aloud "Emmy" and then hung up the phone. Still my favorite Viagra story. Client brings in her dog for a tick she tried to burn off. Looking, I see it's a nipple and tell her this. She says, "But he's a boy. How can he have nipples?" I say, "Mom, your husband has nipples." Blank stare. Then light bulb moment for her. My friend is a student doctor and is on placement at a small town doctor's office. She had a 70-ish-year-old woman come in with complaints of a small but painless growth that was visible at the back of her throat. Turns out it took her 70 years to notice her uvula. Not a doctor, but I regularly have people come in for eye examinations because when I take my glasses off things are blurry. Often these aren't passing comments during the exam, but the main reason for their visit to the clinic. During residency in an urban USA city, I was in clinic. A very pleasant 50-something lady came in for a physical. Everything was going fine when she casually asks if there are any new vaccines out. She was up to date with everything, so I asked if she had any specific concerns. She was casually asking to see if she could vaccinate her gay adult son against homosexuality. Very nice. Always had a smile on her face, even when I broke the bad news to her. Patient comes to a 19-year-old male. I'm getting his history. "Why are you here today?" "Every morning when I wake up my stomach hurts." "How long has it been hurting?" "All my life." "Well, what is different today that's made you come here?" "My girlfriend doesn't think that is normal." More questions. Exam by a physician. Lab tests. "The abdominal pain always goes away after he eats." "Always." "He wakes up hungry. He thinks it is pain." Not a doctor, but I'm a former Special Forces medic and I treated indigenous populations in Iraq, Afghanistan and several other Middle Eastern countries. Some of the patients and their families asked incredible things of me, such as putting brains back inside after an explosion took half the head off. But I have never been as incredulous as when I had to explain wrong hole to a very old tribal elder who was wondering why he couldn't father any children. My mom tells it so much better, but here's a try. My mom was the head nurse at a clinic here in Houston in the 80s. She worked for an old World War II doctor that had gone into private practice, old school GP, when he returned back to the States. Well, one afternoon she told me that they had a patient come in that was running a high fever and was complaining of pain in her pelvic area. Mum also tells me that there was a stench coming from the woman's lap that could only be described as enough to gag a maggot off a meat wagon. She begins to interview the patient, who told her that her and her boyfriend had been sexually active and that she has been in pain since. She thought that the woman may have contracted an STD and asked her to undress and wait for the doctor to examine her. The doctor arrives and closes the door, only to reopen it a few seconds later, mentioning about the need for fresh air. The doctor noticed that there was a vaginal discharge, began to question the patient about her sex life. Was it protected, non-protected, etc. According to Mom, the patient told her, "No doc, we always use a rubber." The doctor looked down, then noticed that there was a small rubber band extending from the woman's vagina. The doctor reached in with his gloved hand and pulled it out. What came next can only be described as a magician pulling the magic cloth out of someone's mouth. One rubber band after another came out over the course of the next 10 minutes. Finally, once they were all removed, the doctor had the talk with the woman about sex education and that rubber bands were not a successful contraceptive and not what they meant by wearing a rubber, and then wrote her a prescription for ABX. Not a doctor, dental hygienist, had to explain that brushing your teeth with Comet, the cleaner, was not a good way to clean your teeth to a 40-year-old woman. Also had to tell a woman that painting her teeth with white fingernail polish was a bad idea. A 32-year-old grown man asked me if the hot spells he was experiencing at night meant he was going through menopause. Well, it's not called menopause. I had to explain to a grown man I still work with that tampons don't break down in a woman's urine after they were finished using them. He's been married 12 years. It was not his best day. My mother helps the Amish get dental care. One Amish woman complained that she needed new dentures. When asked why she thought so, she replied, "Well, I've lost weight, and you know that when you lose weight, you lose it in your gums first." Doctors and dentists, if you're looking for a community to serve, the Amish can truly use your help. I could write a book about the things I've seen. I was a newly minted graduate with fresh and optimistic views on my life as a doctor. Second week in came this old lady and her very dysfunctional family. They would argue and complain about everything, from the food, the nurses they didn't like, and every single medical decision we made. She was very sick, so her management was just as complicated. She had several children and they all didn't like one another and would not talk to one another. Each time we would have to explain a long update to every single one of them because they are entitled to hear it from a doctor. One of these stories being sitting down and explaining why you don't give Gatorade as an IV drip. They did not understand why we were giving salt water to her. Conversation with her son. "Look, she likes Gatorade. She is drinking it, so why can't you give it to her through her drip?" We explain why. Son frowns. "But it's isotonic." We explain again. "Yes, but Gatorade has more electrolytes." We explain again. "Salt water just seems to be too cheap. Can't you give her something else closer to Gatorade that has electrolytes?" Continues for 2 hours. Wash and repeat every day during her admission. Afterwards I told my fiance. He opened up a scene from Idiocracy on YouTube and I just sat there with my mouth open for a while. While on dermatological rotation, a Middle Eastern patient saw me with what she described as some funny, itching growth in her butt crack. Some quick investigation revealed it to be a severe case of genital warts. I explained the diagnosis and that it was an STD until she shockingly assured that she was still a virgin. Now virginity is a big issue for young Muslim women, or perhaps their families even more, but apparently that doesn't cover anal and therefore no birth control in the form of, say, condoms was needed. EMT here. I had a grown adult try to explain to Emmy that someone else crap his pants. Got toned out for finger pain at a homeless shelter at 0200. We get there and the guy jumps in the truck with very mild swelling to the tip of his right index finger. Here's how the conversation went. Me. "So what happened?" Patient. "I smoked some M and then I fell asleep in my bunk and I woke up next to my bunk and my finger hurt and there was poop." Me. "There was poop? Did you fall in poop?" Patient. No, like in my pants." Me. "So, you pooped your pants?" Patient. "No, it wasn't me." Me. "So let me get this straight. You smoked M, took a nap, rolled out of bed in your sleep, hurt your finger, and someone else came along and crap in your pants before you woke up? Patient: yeah, it wasn't me. My brother is a general practitioner in rural Tennessee. Enough said, right? He says most of his patient visits go about like this. MD: well, person, you're pre-diabetic, have high blood pressure, and are complaining about joint pain. Have you been exercising and cutting out sugar and carbs? Person: yeah, I have, doc, but it doesn't seem to help. Do you have any better meds you could prescribe? MD: well, let's talk about your diet. How much water do you drink a day? Person: I don't like water, so I get extra ice in my sweet tea every day to make sure I get enough water. MD explains how that's not enough water by a long shot. How much sweet tea are you drinking every day? Those can have a lot of sugar in them. Person: well, I get a large one from Hardee's McDonald's wherever on my way to work with my breakfast, and another one on my way home for dinner. Then I have a glass or two when I get home. MD: well, that's a lot of sugar, and a lot of fast food if you are eating it twice a day. What do you eat at home? Person: I don't like to cook, so I usually don't eat anything but Little Debbie snack cakes at home. MD: those have a lot of sugar too. Person: I thought that all I had to do was cut out Mountain Dew. Now you're saying I can't eat my food or my snacks. What are you suggesting I do? Eat salads for every meal? Why can't you just have my meds? I'm not a doctor, but my mom doesn't have a good grasp on the reproductive system, so I had to be the one to explain that. 1. Getting my tubes removed did not remove my ability to get a period. 2. That we women have a urethra, a vagina, and an anus. Babies do not come from the urethra. This one was strange because she had me and my sister, so. 3. That when you neuter a dog, you just remove the balls, not the red rocket too. China Taiwan's sex ed was severely lacking, so my mom, until she was in her 20s, believed that if you sat on a seat still warm on the bus that a guy sat in before you can get pregnant. If you kissed a guy, you could get pregnant. I'm still finding out, years later, misconceptions that my poor mother has about reproduction and explaining things to her. Had to explain to an adult you have to brush all the sides of the teeth. Like, no, just the side that shows when you smile is not enough. And yes, flossing is not just a thing for rich people. Had a patient in our high priority area for DKA. Sugar was in the 800s. Stomach pain, nausea, vomiting and the such. Pulled Burger King and gummy worms out of his backpack and proceeded to eat them. Like, bro, do you even know what diabetes is? Non-compliance and lack of medical knowledge is a big thing in Detroit. Patient comes in at 2 AM for insomnia, clearly tweaking her brains out. Heart rate 200, can't sit still, bouncing off the walls. I suggest maybe easing up on the coke. But doctor, I love coke. K. I imagine her pulling out a crap load of coke on the spot and just ramming it to her nose. I was working in GP and had a patient scheduled for an appointment. Looked through his notes to gain an idea of why he may be seeing me and saw he'd been seen a few times with knee pains, shoulder pains and the like. The guy's in his 70s, so probably just arthritis. I'm thinking I'll do an examination on his sore joints and ask a few questions. Prescribe some painkillers and it'll be a quick one. Call him in and he walks in, sits down and is cheery as anything. What seems to be the problem then, sir? I notice you've had some issues recently with sore joints, I ask. He then proceeds to tell me about this sore knee. So I check his knee and take a history and it all seems fine. Ask anything else and he's like, oh, actually my neck is sore too. So I check his neck and nothing untoward to be found there either. At this point he's like, okay, well thanks doc, I'll be off then. I say to him, oh good, glad we could help. And you have no other pains at all before you go? He then sits back down and tells me he's been having central, crushing chest pain radiating down his left arm and into his jaw since last night and has been feeling breathless, and when it happened he had an impending sense of doom. I know a lot of you won't be doctors here, but I'm sure you all recognize signs of an MI there. He had all the classic textbook symptoms, called an ambulance and he was rushed to hospital for PCI. Both my parents are doctors. My dad told me about an extremely religious male patient who was concerned about his nocturnal emissions. He saw it as an offense to God and wanted to know what he could do to stop it. My dad's response, well, it's gotta go somewhere, guy. You have been visited by the chunk of good fortune. Like this post to enable good fortune for 26 minutes. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check out another video, or don't. Either way, have a great day you magnificent people.